A lot of the cold weather advice that we offer here on the news is common sense and really should go without saying, yet children end up in the emergency room at Children's Hospital all season long with winter-related injuries. Katie Horrigan is director of the Community Health Education at Children's and part of the Coles Cares Grow Safe and Healthy program. We've got a lot of very timely advice. Great to see you, Katie.
Thank you.
Yes, so this is a really important issue right now with dangerous wind chills. So let's start with your top 5 here. Item number 1 is layer up.
Layer up. You're not going to survive this cold without having lots of layers. So I have laid out here today 3 layers of clothes for those kids when they're standing at those bus stops. I felt so bad for them this morning. Making sure that we consider the type of fabric. So cotton, not as warm as wool or silk or fleece. So just little things to think about. Mittens are warmer, they say, than gloves.
They are.
So,
absolutely.
Yeah.
All right, load up. And you have something that we don't think a lot about this time
Totally.
of year, sunscreen and staying hydrated.
Right. Sunscreen is necessary in the winter as well. If you think about it, snow is white and there's a lot of glare that comes off of that right on your face. If you're going skiing, sledding, that kind of thing, it's important to wear that. Anyone who has shoveled snow outside knows when you layer up, you end up sweating your butt off when you're outside. Sure. So you really want those kids to be drinking water as well because they're sweating too. Also, particularly with the younger kids, just because they're outside and playing and healthy and all good, make sure you're supervising them at least to some level. Absolutely. Kids 8 and under really need direct supervision. They're not really that likely to come in and say, hey, Mom, I'm cold. So you need to watch. You got to watch and pay attention. Now, let's talk about the signs of frostbite and hypothermia. Also important to know that. Right. Frostbite is when those fingers and toes and ears and noses are starting to really freeze themselves too. So if you're seeing that, use warm water, not hot water burning. You can actually get a burn from warming them up too quickly. Talk to your pediatrician. Hypothermia is when your child just cannot warm, their body can't warm up anymore, and that's an emergency. Call 911. Your last one here, I really love this. Watch the weather. Right. There are great ways to do that. So plan ahead, watch the weather, bring extra blankets, just know what you're dealing with and prepare for it. Yes, and there's Jesse over there applauding. Absolutely. All right. Well, great to see you again, Katie. Thanks so much for the top 5. And if you want to review our top 5 cold kids safety tips we've talked about here, it's posted online at Coles Cares Grow Safe and Healthy. We set up a link for you at tmj4.com.